this around. So I'm just going to talk for the next 15 minutes as to what we're going to talk about in the Fordney book for the insurance. Okay. For the Fordney book is dealing with the paper claims and is dealing with the electronic claims. Okay. So just to give y'all a brief history, let's talk about the history of the paper claims. Okay, so we're going to talk about that. Now, back in the day, when I first began processing claims back in 1980, in the early mid 80s, we used to call them HICFA 1500. Okay, that was back when I was 17 years old. I'm telling you my age, you know. Okay, and so HICFA 1500 has now become CMS 1500. Okay, means the same thing. It's just is now updated as the name CMS 1500. So if I say, Raven, give me a HICFA 1500 form, you know exactly what I mean by what? CMS 1500. If I say, Jacaria, give me a CMS 1500 form, you know exactly about what I mean by a what? A HICFA 1500. Very good. They're both the same. Okay. Now, let's go. Now, this is another thing. UB 92, and the new name of it is UB04 or UB04. Okay. UB 92, Universal Bill 92, Universal Bill 04. If I say, Danielle, bring me a UB04, you know I mean a what? If I say, Nelly, bring me a UB92, you know I mean a what? It's UB04. Very good. Very good. You ladies are paying attention. I like that. Now, let's kind of swerve this podium over just for a minute. Now, the CMS 1500 form is used for physician billing. Physician billing. Okay? And or outpatient billing. And we're going to talk about what I mean by that, outpatient billing. UB04 is used for acute care or skilled nursing facility billing. Okay, that's what it's used for. Okay, now acute care is the same as inpatient care. Okay, or it can be used for long-term care facilities. Long-term care facilities are folks that need to stay in the hospital more than a week. Okay, and it depends on if that hospital can house them 2 or 3 weeks, because the long-term facility may not have all the equipment or everything suitable to take care of someone over 3 or 4 weeks. So therefore, they got to stay at the hospital. It depends on the situation. Does that make sense? So if I say, Jacaria, acute care means the same as what? Inpatient care. Inpatient care means acute care. Acute care means inpatient care. So why using interchangeable words? I'm glad you asked. I can see it written all over your face. Y'all are just so curious. I just had to say it for you, okay? Because when you all get ready to interview for jobs, You need to understand the lingo that they're talking about. If they say, Nellie, you're going to be doing acute care billing, you need to understand that they're saying you're going to be doing some inpatient billing. That means if you've never done inpatient billing before, and they say you're going to, then that already gives you the clue that they're going to train you, right? Yes. But you always want to make sure and say, I have an idea how to do it. I just need you all to refresh or go over with me on the billing process. And I know I can do it. And yes, do I have confidence that you can do it, Raven? Yes, I do. Yes, I do. You all can do anything. The main thing that I talk about and preach about all the time is what? You being what? Vocal. You have to speak up. A closed mouth don't get what? Huh? 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 Fed. A closed mouth don't get fed. If you want to make some l'argent, everybody say l'argent. Très l'argent. Très l'argent. C'est l'argent, Raven, l'argent. L'argent, very good. Very good. Très bon, c'est bon, très bon, très bon. C'est l'argent. C'est très l'argent. Very good. Très, 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 c'est très. Tray. Say tray. Now, roll your tongue on the top of your on the roof of your mouth. Tray. 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 Bless your heart. Nelly, say it with me. Tray. Tray. Say it with me, Jacaria. You say it with me. Say it with me, Jacaria. Tray. Tray. Say it, Raven. Très. Très l'argent. Mean lots of money. I need to make lots of money. That's that Geechee talk. I need to make lots of money. I want lots of money. Okay, now. These are the differences. Inpatient billing is different from outpatient billing. Okay? Very different. When you're doing inpatient billing, you are using DRGs. We're going to talk about that. You are using revenue codes. We'll talk about that. You will use a discharge status because we need to know, was the patient transferred? Did the patient voluntarily leave on their own without signing out? We need to know, okay? And sometimes you will use CPT and or HCPCS codes. Okay, now, and you will also use for diagnosis, you will use the ICD-10 PCS, and for inpatient only, you will use the ICD-10, sorry. Thank you. You own it, girlfriend. You own it. Had it backwards. Thank you. Okay. So for procedure code, you would use the ICD-10 PCS. For diagnosis code, you would use the ICD-10 CM. Very good. Very good, Raven. Very good. Now, for physician, you're going to use the CPT book and or the HCPCS. Okay, that's for procedure coding on an outpatient basis. If you're going to use for diagnosis, you're going to use the ICD-10 CM. Okay, now, if anybody ever tell you that you use the ICD-10 PCS for physician billing, tell them Ms. Harper said, that's a lie from the pit of hell. You need my business card so I can come over and charge you $75 an hour to tell you that you don't know what you're doing. I'm going to tell you straight up, you don't know what you're doing. You don't use an ICD-10 PCS in a physician office for billing, nor on an outpatient surgical for billing. You don't do that, okay? This right here, ICD-10 PCS, have a 2-digit procedure code number. And if you are billing for a hospital that's contracted with CMS and has the conditions of participation as part of their policy accreditation standard to say that, yes, we can file with Medicare, we've met all the standards and the criteria to receive such payment, then you have to use the ICD-10 PCS diagnosis procedure code for DRGs. DRGs mean diagnosed related grouping. Is it 7:30? Almost. Okay. Diagnosed related groupings. Okay. And this is written by CMS. They go by weights. Weights have how much they charge. So I've given you a preliminary of the paper claim, the history of it back in the day when I was years old, back in 19, and we had the HCPA 1500 form, and now we use the CMS 1500 form. We had the UB92 form, and now we use the UB04 form. Okay, we're going to end it right here. We're going to go to lunch. We're going to come back. Does anyone have any questions for me thus far? Okay, very good. All right, so we'll end the conversation here. Everybody go to lunch, enjoy yourselves, come back in 30 minutes.